Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Mr. Chairman, Co-Chair, Professors, Organizer. Today I am presenting on topics effectiveness of pharmacist-driven intervention in the knowledge regarding inhaler use by COPD outpatient of a respiratory disease specialized hospital in Nepal. Me, Ghulam Muhammad Khan, School of Health and Allied Sciences, Pokhara University, Pokhara, Nepal. Let me start with the background. What is COPD? Chronic obstructive pulmonary disease is a progressive lung disease characterized by chronic obstruction of airflow, and it is not completely reversible. The inhalation route is the most common route intended for the administration of the drugs in the treatment of COPD-like condition. However, incorrect application of inhalation techniques leads to poor treatment outcomes. Notably, pharmacists have a major role in providing appropriate information and training about medication, inhalation techniques. Research objective. General objectives and specific objectives of these topics is to assess the knowledge of the inhalation techniques and give the intervention. Methodology. COPD patient visiting the National Respiratory Disease Hospital, Nepal. Inclusion criteria. The patient should be diagnosed with COPD according to GOLD guidelines with or without comorbidities, and the prescription is prescribed with metered dose inhaler or dry powder inhaler. Study design. It is pre-post interventional studies. Let me start with the disease. If you see the age, then you will get the most of the patients and the age starting with the 41 to 90, and the most of the patients they fall under the 61 to 70, and the females are more prone to this disease. If you see the material status, near about 85% they are married. The family types is joint family. Similarly, illiterate peoples are more in this. Source of incomes, most of them they are involved in the agriculture's farming. Regarding the smoking habit, most of them they are former smokers, and in farmers more than 1 year they are not taking any cigarettes. And regarding the current smokers, they are taking whole packets per day, and packet contains the 20 cigarettes, and exposed to the second-hand smoke. Yes, there is second-hand smokes also. Known allergy. Yes, there is a known allergy, and the most is the dust. Dust is the most important. Now, regarding the inhaler prescriptions, as I mentioned you, there is two types of inhaler they use, prescriber used: metered dose MDI and dry powder inhaler. And prescription contains the metered dose inhaler. Metered dose inhalers near about 40%, and DPI dry powder inhaler 60%. Let me start with the MDI. We have 8 steps in this, and we assess all these steps with the patients, and what are the difficulties, or whether the patients are taking rightly that steps or not, we check. Then we found before intervention the results was very poor, But after intervention, result would dramatically change. Level of knowledge we have divided in 3 parts: poor knowledge, adequate knowledge, and good knowledge. Before intervention, poor knowledge 33 numbers, frequency is 33. After intervention, frequency is 0. Adequate knowledge, frequency were 4, but after intervention it becomes 2. And good knowledge, before intervention it was 1. After intervention it is 36. So it is after intervention the result is quite good. Similarly, we assess the mean also. Before it was 3.53, but after intervention mean is 7.71. So with this the null hypothesis, there is no significant difference between knowledge score before and after intervention, was tested at 5% level of significance, and the Wilkinson sign rank test was performed and null hypothesis was rejected and p-value is less than 0.01. Similarly, we access the DPI also, dry powder inhaler. In this there is 8 steps. In MDI there is totally 8 steps, but in DPI there is 11 steps. So we assess the DPI also. The same, it was in the DPI, poor knowledge was 14, but after the intervention it becomes 0. Adequate knowledge was 37, after intervention it becomes 4, and good knowledge only 6 before intervention. After intervention, good knowledge increased to 53. So it is very nice result. It comes after intervention. Form 60.